everyone, welcome to a new video. This video is another Q&A. Thanks to you for all your questions. So let's dive. Hi everyone, welcome to a new video. First of all, I want to say thank you to everybody who's been sending me all their questions, whether through this channel, preferably, or LinkedIn or any other platform. I collect from just under around 10 questions, and I regularly post them. So if you're new to this channel, welcome. I'm Aida Noor. I'm a UK registered biomedical scientist who's taken the longest trip to become qualified biomedical scientist. I took the untraditional path. I didn't have an accredited degree. I didn't have lab experience. So that's why I use my platform to share all of it. So today's video, we're going to be exploring, mainly the theme is going to be like the future of biomedical science in terms of career, studies, NHS application and advice. So let's go. So the key topics that I'll be covering in this Q&A, I prefer you guys to comment on the video because at least I know what I've covered or what needs to be covered. So preferably send on this channel, and thank you all of you. Some questions are amazing, and stay to the end because you guys surprised me. So thank you for continuing this platform, this conversation. So what we're going to be covering is biomedical science versus biomedical engineering. What are the master choices that you might have after completing your BSc or bachelor's in biomedical science? We'll talk about HSP registration if you don't have any work experience or you had a placement here. How to get a job if you don't have a degree. You want to experiment or explore. And we will also look at navigating your career uncertainty about biomedicine or biomedical science. Biomedical science, biomedicine, I'm going to be using them interchangeably, but I will talk about the difference between them and what they are, because I've noticed there's new names now, and biomedicine is being used more often now recently. I will talk about that in upcoming videos, so stay tuned about that. So let's dive into the first question. So the first question is choosing between biomedical science and biomedical engineering. Should someone choose biomedical science over biomedical engineering if they are stronger in biology and chemistry rather than maths, computers, and physics? Biomedical science aligns biology and chemistry, focuses on human biology, disease, and diagnostics, with less emphasis on physics, computing, or device design. Biomedical engineering, it's more maths and or tech savvy. So you would choose based on your strengths and interests. So what's the difference between them? Biomedical science means or equals lab diagnostics, human biology, clinical science. Medical science is directly dealing with patients' samples. Biomedical science is disease diagnosis. It's involved in disease diagnosis. Doctors cannot make a decision about medication or treatment without us sending the report after interpreting and finding what's causing the infection. So think of it that way. Where biomedical engineering is involved in medical devices, creating solutions, it's tech-driven healthcare programming. I've shared a video about comparing between them extensively, so check that video where I talk about the differences between them, the type of courses for each, the skills, the future perspective, etc. It's definitely worth watching, so check that out. And I normally have a playlist pinned with all the videos in them, so have a look at them. But it's I've just shared it recently, so have a look at that, and I've seen some great engagement about that. It was new to me because I didn't know that biomedical engineering existed myself, so thank you. All your questions are educational. It's a two-way conversation. So what I would advise you is choose on your natural strengths and long-term interests, and this is what I say in the video as well. I explain how you can choose and how you make up, you choose the right decision for you. So I hope I've answered this question, but regarding this, I'm not going to talk much about it because I did dedicate a whole video to that. So have a look at that and let me know, and keep your questions coming. So let's move to the next question. So the next question is, Should I continue with biomedical science or go for biotechnology or cancer biology? Like I said, biomedical science will involve working in labs, whether in NHS or private, and you do need to be state registered on the HCPC. Biotechnology, you work in pharma, innovation industry. Cancer biology will involve a lot of research, whether in academia, and most likely you will get involved in PhD work. So you need to choose based on your future career goals. What are your aspirations? Let's have another look at this to decide if you want to, what type of masters you want to do. So if you decide to choose biomedical science, your interest will be clinical diagnostics, working in NHS or laboratory, and you need to be registered with the HCPC. I've spoken about that in many videos about the HCPC, and recently I spoke about if you're an international or a home student, so check those videos. Your typical careers, once you become qualified biomedical scientist, you will specialize, and I've already spoken about the specialism in a previous video, so have a look at that. It's the most difficult. I found it the most difficult to gather and to deliver. Like, for example, I myself, I specialize in infection sciences or medical microbiology, and I've worked in both in the private and the NHS. So that's the typical places you will be working if you decide to work in a lab. Again, lab is not the only place where you will work if you are a biomedical science graduate. If you choose to do masters in biotechnology, you will be heavily involved or you're interested in innovation, pharma and industry work. Typical careers, you will be working in biotech companies or research or industrial R&D or research and development. If you choose a master's in cancer biology and you want to continue your career from that, you will have interest in oncology, research, or and eventually you want to pursue PhD. Typical careers, it does involve academia, clinical research, and eventually you will pursue in PhD, because cancer involves a lot of research. It's an ongoing research. So that leads us to the big question: how would you choose? What's the best for you? This will be my advice for you guys. You need to think, what excites you the most? Do you like diagnosis, like myself? I like the clinical side of healthcare, so that's biomedical science. Do you like innovation? So that will be more like biotechnology or engineering. Do you like research, constantly studying, constantly finding out, creating solutions? That could be cancer, it could be any of them, but like in this concept. So what I would advise you is to check the content. You need to do your research. You need to really read between the lines and look at the placement opportunities. That's very, very important. Getting experience or industry experience, it's the most crucial in healthcare in general. That's the most important aspect. This is something I wish someone told me when I started my career. So also think about how far, look ahead. Think in the next from 3 to 5 to 10 years where you're going to be. Have that, at least an idea where you're going to go. And align that with your career ambitions, not how popular it is. Not because your friends, they did it, you have to do it. So think of it that way. So your master choices after biomedical, bachelor's in biomedical science, very important to explore the pathways. And that requires a lot of work from you in any career, not just in biomedical science. So it's very important to choose the right master's program. For example, when I chose biomedical science, I was hoping because let me give you a bit of a backstory. I didn't do biomedical science as a degree. I did biochemistry degree. I studied in the UK. And I didn't know what to do with this degree, and I didn't enjoy it, to be honest. I knew I wanted to do science, but I didn't have that mentorship and guidance, so I still hold the responsibility for that. So I did masters in biomedical science because I thought it will be accredited and I'll start all this lab thing, HCPC, to become a biomedical scientist. Little that I knew that it wasn't accredited, so I had to start all over again and to start the whole journey. I've already shared that in previous videos. So I didn't have accredited degrees, I didn't have lab experience. So if I knew the masters was not accredited, maybe I would have chosen better. So what I want you to take away from this great question is choosing the right master's program can significantly impact your career trajectory in biomedical science. So consider your interests. What are the career opportunities that are associated with the program? And it should align with your long-term goal. Remember, having a job is completely different than having a degree, having a career. A job is part of your career, but a career is a whole package, your interests and your life choices. So let's move to the next question. Can someone complete the HCPC training portfolio without doing a placement year as part of their biomedical science degree? Yes, but it's more independent. You must secure an IBMS approved lab position, complete the portfolio, the IBMS portfolio, outside university. Some labs might offer graduate opportunities, but it's very rare. So it is possible to do the HCPC registration without a placement year. I did that, but it requires a lot of work, and I'm telling you, I know how difficult it can be. I can tell you all about it. That's why I've initiated this whole channel. So in stepwise, yes, it's possible, but you need to put extra effort. You must find an IBMS approved lab independently, complete the portfolio. Some labs will help you. It will take longer, but it will lead to HCPC registration. I'm going to tell you my story. When I finished my master's degree, I worked in a lab. I eventually found a medical laboratory assistant lab in a specimen reception. It was in private because getting into the NHS was extremely difficult, and I'm sure a lot of you know about it, and we're going to discuss that in one of the questions that I got sent about the application. So the first opportunity was to get a private position, and I started in specimen reception. Then eventually I got into microbiology by speaking to the manager. Just directly, I spoke to him. I said, I explained my story. And then when there was an opportunity, I joined. And then for a couple of years, I've worked in night shift, I've worked in daytime. And then I wasn't going anywhere. And then I decided to take the initiative and called every hospital, called every hospital in London, because I was based in London. And all of them, they said no. And then I eventually had two calls. I called one in Dartford, I remember, and one was in Oxford. Both of them said yes, and I was deciding whoever's response first, they will. I explained my situation. I said, I'm an MLA, I've done this, I've done that. I just basically pitched for myself because this is the only way to go forward now. And I've explained that in many videos on how you can do that, how you send an email, how you can cold call. And then eventually I met the manager and I explained my situation, and then I got in. And then we're going to talk about how I got in the further questions, because that's related to that question. So the point I'm trying to make, it's possible, but you have to put in the work. Fast forward, I got qualified finally. I got the training, I got the portfolio. I had years of MLA in my pocket, so I was very lucky. And eventually I got a role in the private, and now I'm self-employed. This is my 4th year to become self-employed biomedical scientist, so it's possible. The good thing is it gives you that resilience, but you have to put in the work. So just to give you a bit of hope that it's not impossible, but it's possible. So what I want you to take away from this question is you need to appreciate that a route does exist for non-placement graduates. You have to apply to either NHS or private labs. They do offer training, but you have to put in the work. You have to pitch for yourself. You have to be honest from the beginning. You can apply whether as an MLA. Don't aim for trainee because it's nearly impossible. However, even if they exist, it's extremely competitive. So rather than you wasting time and waiting, just put your foot in. And a lot of us worked as a medical laboratory assistants or AP or associate practitioners and did the portfolio at the same time. Consider volunteering if you're just a student, because this is one of the best ways to put your foot in. And then when there's an internal position, you will be prioritized because they've seen how you work. So some of them is try before you buy. I'm sorry to say that. And then once the portfolio is done, you become IBMS competent, and then you can apply for the HCPC. So it's not impossible. A lot of us done it, and it is possible. There's a lot of people getting trained now. So just think, you have to put in the work. It's not impossible. It's possible, but you need to put in the work. Now to the next question. I want to become a lab technician, but I don't have a science degree. I've worked as a healthcare support worker. How can I get started? Well, you can apply for lab assistant jobs, medical laboratory assistant roles or supporting roles. There's either band 2, you can start as a band 2 if you apply into the NHS. So I think band 3 you can apply, I'm not sure. But this is the first way you can get in if you're in the NHS, or I'm not sure about the private if you have to have a degree. You just need to look at this description. And then you can use your healthcare experience as an asset. Consider access to science or level 3 qualifications. NHS or private, they might offer training like I've explained in the previous questions. Apprenticeships can be a great route, so have a look at them. There might be some that are out. How you can do that, I'm telling you, you have to be on LinkedIn, because I've seen some amazing advertisement on that. So let's look at this deeper. Start with support or assistant roles. Build on your healthcare experience. Access or level 3 science courses can help. Look out for NHS or private jobs. Apprenticeships are an amazing way because you see what it's like to get into it. So entry routes for non-degree applicants do exist. Lab roles often begin by you working in specimen reception, where you do sample preparation, admin work, stock preparation. This is what I mostly noticed in the NHS. A lot of people who work as a medical laboratory assistant or MLA band 2, they start in the reception area, and it's a very good starting point to see if it's for you or not. Even MLAs band 3 or APs, we all start in reception, because this is where you learn about the specimen preparation, the whole process from the moment the samples arrive until the booking in is complete and the distribution to the designated benches. And I've explained that in previous videos about the MLAs and what they do, and the banding, the skills, the job perspectives, everything. So have a look at that video, and that will give you a greater or deeper insight into it. Your healthcare experience, it will show your readiness and the skill set that you have, and therefore you progress through your experience, your CPD, and you might end up on an employer funded training. So it's not possible, it is possible. So now to the next question. I love this question. That was very interesting. How did you know which job was right for you in biomedical science? I told you some of my story. I didn't know at first. I tried different paths, reflected, trial and error. Yes, experience did help me. Exploration did help me. It is trial and error, and it's part of the journey. And your interests will evolve with time. So what do you do when you're unsure about your career path? It's normal to feel unsure about after graduation. You will find a role once you start exploring with what fits you. And feeling lost is absolutely normal. It's part of the journey, so you're not alone. So how would you navigate uncertainty? This is what I would advise you, is start with your favorite topics. What do you like? Hematology, microbiology? Do you like working in a lab? Do you like working in an industry? Do you like patient-facing positions? I would advise you to network heavily. We are all on LinkedIn because we have to join groups and do short placements, even if you need to volunteer, because this will clarify what path you need to do. And you know what? Bear in mind, it can change. I am grateful that I've tried NHS and I've tried private, but I'm really grateful that I started in the private first as an MLA, and then I moved into NHS when I wasn't going anywhere, and I qualified as a biomedical scientist. And then when I got qualified, I didn't want to travel far, so I managed to get a private position as a biomedical scientist in a private lab. And then once I resigned from that full-time job, it was COVID. It was I've spoken about this story in full. I resigned, and since then I became self-employed, and I've worked in different NHS labs, mostly automated, which is my favorite. I spoke about automation in a previous video. So looking back through the whole journey, from the time I finished my degree, I didn't know what I wanted to do. When I finished my degree, I was told, oh, you need to do the registration, you need to do this, you need to find the lab, you need the portfolio. I wasn't sure, so I was like, okay, shall I choose between pharmacy? Shall I choose between shall I do pharmacy or shall I do biomedical science? So I was like, okay, at that time I didn't want patient facing, so I thought, okay, I'll go for biomedical science. I want to be in a lab at that time, but now looking at it, I don't mind dealing with people. So I had to apply for the first lab job that I've applied for. And then it started from there. I started in specimen reception. Then I wanted to work in microbiology, because microbiology at that time, it was Monday to Friday, no weekends, no evenings. The pay was really good at that time. And then I spoke to the manager directly and I said, this is what I want to do. And he said, okay, there's a night shift coming up. And I was like, oh, night shift will be a good idea. I got into the night shift because I wanted to do the training. I enjoyed it. But then I didn't like it because it was getting tiring. Then I waited until a daytime position was available. Then I was like, okay, it took me a long time. Why am I not getting qualified? I was waiting for the opportunity. It was my fault. Then I decided, okay, I'm going to call every hospital. So you just have to keep trying and not give up. And we're going to talk about that, why it's definitely worth this career in future video. So let's move to the next question. Sister, do you help me for application to crack NHS job, please? This will be my advice. I know it's a very common problem. Like I said, I couldn't secure a job in the NHS. I don't remember when I did. So the first thing I would say is understand the job specification. There's a job description and there's a job specification. The job specification, that's the one that you need to base your application on. Use a STAR method. Highlight your transferable skills. Apply obviously via the platforms. Entry roles such as MLA, medical laboratory assistant, associate practitioners, they can be a good option. How do you crack on that? Read and tailor your application to the job specification. The person's specification, job specification, these two, very important. Use the STAR method. Situation, task, action, results. Highlight your skills, soft skills, transferable skills. They are the same, by the way. Your teamwork, attention to details. These are the ways that you need to apply for them. Register so that you apply accordingly. Set the alerts and apply strategically. And don't forget, you can apply to entry level roles. I'm going to share my experience with you guys. I know it's the most difficult to apply to the NHS. The times that I applied for NHS were very few for me in my life because, as I said, I started in the private. So I shared in a video about my experience working in the private and the NHS, and check out that video where I share my experience about it. But I understand it's difficult to apply for NHS. I remember there was a lab assistant I worked with. She said she was contacted a year later, and she said the way she put, I think if I'm not mistaken, a lot of people who entered the NHS, they had to do cold calling or email directly, because when there's a job opening, they receive hundreds and hundreds of applications. So going through them, it's very lengthy, and this is after me speaking to managers and to understand the process. So for me, my own personal experience, I opted for the private. I was applying for both, and at that time I was seen as a failure because people said, "Oh, you should look for NHS. Why are you working for private?" But now, fast forward after all these years, the private are offering the same perks as the NHS. But people think, "Oh, if you make a mistake, you get fired." No, you're not going to do anything stupid in the lab. Actually, it's worth trying. You want to put your foot in. Now I work for the NHS as a self-employed. I go through an agency, so it's also called locum. And I work for the NHS now. But whenever there's an opportunity, I will, whenever there's a job, I will work for the lab because the agency will onboard me to that. All I need to do is let the agency know I want to work for this lab. They send my CV and that's it. You start on Monday, done. But when you apply for the NHS, it can be different. When I got my last NHS job, I called the lab. I said, I am this, I am that. So I worked as bank. And then from there, I started my journey. So yes, applying for the NHS is very difficult and is highly competitive, but don't limit yourself. Start in the private, get your experience, and then you can move into the NHS. And that's what I did. So, but then little that I knew, I've expanded my skills because I've explored both ends, the NHS and the private. So don't limit yourself. Get started where the opportunities are, and have a look at my video about the NHS and the private, where I give you an extensive overview and insight about my experience and what's the difference between them. So let's go to the next question. I graduated from an IBMS accredited degree but lack experience. I'm struggling to get into the field. What should I do? Thank you for this question. That was very interesting. So it's accredited, but they don't have lab experience. So what I would say is apply for MLA or supporting roles. Explore, again, both NHS and private. Consider volunteering, shadowing, or do CPDs online. I've spoken about CPD in a previous video, which is continual when you are a member of IBMS or the HCPC. You can do continual developing. I can't remember that. Drop in the comments. I always forget. We're so used to acronyming things. When I come and say it in full word, I forgot. Continual professional development. Yeah, that's it. And be an explorer on LinkedIn, because there will be loads of opportunities out there. And don't underestimate the power of networking, because it's extremely important. So yes, there is a struggle to get into biomedical science. So don't forget these three things. These things is to consider assistant role, MLA or medical laboratory assistant, AP, associate practitioner, volunteering or shadowing, or just put your foot in to get that experience. We all had to volunteer at the start of our career. I had to do that at the start of my career. And don't limit yourself. Explore both private and NHS. And LinkedIn is a fantastic tool for being visible and seeing what opportunities are out there and sharing your story, and also for any job offerings, because sometimes people who are responsible for hiring, it's easier for them to post on LinkedIn to maximize reach. So I have seen it recently. I've seen a fantastic position that made me reflect and create a video about it, which I'll be sharing with you very, very soon. So just think, you are not alone. There are many graduates are in this phase. Keep building, and it's very important to be very proactive and an active user. Experience and visibility do matter, and staying consistent and engaged is extremely important. It's not an option anymore. It's a necessity now. So bear that in mind. So let's move to the next question. What project can I do in clinical design research? That was very interesting. All your questions are interesting, guys, but it's just I'm learning with you. So this is what I would advise you. Start with a real healthcare problem. Focus on improving patient pathways. Use digital tools, applications, wearables, dashboards, proposal-based or small pilot project. Clinical design research projects, they are aim for improving trial access or diagnosis. They use patients' feedback in framing projects. They explore digital health tools or surveys. So that's what they normally are based on. So you normally start small and relevant. You need to choose something that is feasible and ethical. You can use publicly available data or design framework. So you need to have a clear and thoughtful projects in order to get, to create that great impression. So that was very interesting to learn. And at the moment, because of technology and AI is on the rise, there's loads of, just think of creating solutions in healthcare, utilizing all of these tools that we have. And in the previous video, I've discussed the future of biomedical science. So have a look at that, because I talk about that in greater detail. So I hope I've answered this question in a way. And that was really eye-opening for me, because I was like, and it's on the rise. So it's extremely important to, and that way you never know, you might end up to become an entrepreneur, and that will lead to, you can get somebody investing in you, and then you kick off your career being an independent entrepreneur. So let's move to the next question. Thank you for sending that, because at least I can share my story about this. Can a full-time MLA work on the bank? Are there ways to earn some extra money? Yes, you can combine permanent roles with bank shifts. Bank roles, they offer flexibility and extra income opportunities. You can start as a bank staff to gain experience and visibility. When permanent roles open, you can negotiate part-time plus bank shifts. Combining both can match or exceed full-time salary. It does require proactive networking and asking for opportunities. Yes, it's possible with the right arrangements. Yes, bank means extra cash, flexibility in hours. You start as a bank or part-time, permanent. Combine both, full-time will match a full-time salary. It requires you putting the right initiatives and negotiating with the managers. I have a personal story about this. That's why I wanted to leave it to the end. When I couldn't get qualified to become a biomedical scientist, and after calling all hospitals, and I finally managed a manager who said yes. He said to me, send me your CV. I sent my CV, and he said, when can you come? Let's have a chat. So I went to speak to him. At that time, I was at my lowest. I was willing to volunteer, and he said, okay, I'm going to offer you an MLA level 3. Level 3, that's where you can do your portfolio. Level 2, you cannot do your portfolio, the IBMS training portfolio. And he said, you can work as bank. I didn't know what bank was. I thought you just have to go through locum agency in order to work. He said, no, bank, you directly work with the hospital recruitment, and the hospital will pay you. So it's like basically you working on demand. And that was fantastic, because I remember I worked Monday to Friday full time, and I was on bank, and I was getting paid weekly. And when there was a permanent position advertised, it was part-time. I applied as an internal. I got interviewed, and successfully I got the job, and that was part-time. So I remember it was Monday to Wednesday. And Thursday and Friday, I was still on bank. I was working as overtime. So that way, I managed. So the moral of this story is, when you make things happen, they will happen. I never knew about banking. I never knew about negotiation. I never knew about all of this if I didn't try and just go for it. And at that time, people were doing it, but not many people were talking about it. But now, with the competitiveness that is happening, it's a necessity. But the advantage that you guys have, you've got the online. At that time, LinkedIn wasn't that popular, although LinkedIn has been 20 years plus. But now you have to, you are being introduced as students about the importance of LinkedIn. So at that time, you had to go and, find your way, speak to people. These are the things I learned later on. And that's when I published my first book, Ida Nur Thoughts, where I spoke about what you need to know, what they don't tell you when you start your career. So that's when I shared it all in my book, when I started journaling and sharing on social media, and people said, why don't you just share your thoughts? So yes, unfortunately, this is the harsh reality, you have to put in the work. You just can't rely on things just to happen, or applying for jobs. Opportunities are there. There's something called the hidden market, so you have to put in the work and try. So first of all, I want to thank all of you for those amazing questions. Keep those questions coming in, because this is how we continue the conversation. I'm learning with you, because if you don't tell me what is the current issues, I won't know how to help you or how to share the current situation in terms of biomedical science, the future, the current situation, what are the challenges. So I have to take this opportunity and thank all of you for those amazing questions. Truly, you guys are, amazing, because you are challenging me as well, because I want to help all of you. I want to help you all in this, because I know how difficult it is. Keep those questions coming in. Any concerns that you have, let's keep growing. We are in this together. I hope I'll see you in the next Q&A, and I'll see you in the next video. Until next time, keep shining, keep inspiring, and see you next time.